When Peter and I were talking, he mentioned that the first topic that I would be part of was managing through crisis. And the question was, did I have some comments around that? Keeping it to just 3 to 5 minutes. So that's my goal in thinking about that. When Peter brought this subject up, I started thinking about crisis in healthcare during the pandemic. We don't come to work every day thinking about that we're going to manage a pandemic that happens once in a millennium. But that's what has occurred. And it's given us the opportunity to think through how do we actually work in our organizations, especially in healthcare. Because as you realize, as you know, the healthcare industry, the hospitals have been the fulcrum that has truly, I believe, in this country, supported our management through this crisis. Without the healthcare, the hospitals doing their job, I think we would have been in significantly tougher shape from that standpoint. So just a few points or thoughts around managing through a crisis that I'm sure we'll talk more about. These hospitals that we work in, the hospital that I work in, we talk about it in many respects like working on a Queen Mary. And the question is, how do you turn a Queen Mary quickly? How do you make a Queen Mary go from that to a speedboat? Well, I think there are a few points. One is decision making. How have we changed the way we make decisions? We've done it by getting data, but not being wedded and stopped by the data, and not being overwhelmed by them to make decisions. And then we've made decisions. But in those decisions, I think importantly, we've attempted to simplify them. Henry David Thoreau said, simplify, simplify, simplify. And I think that's really important. At Boston Children's, we surrounded our decisions based upon 3 principles: safety, safety, safety. Safety for our patients, safety for our families, and safety for our staff. And all of our decisions have really rotated and been involved around those 3 issues of safety. And with that, we've been able to stay consistent. And then the third point is around communication, and that many of us in the healthcare felt we were communicating. And I will tell you, there's a difference in communicating and truly communicating. And we, in this crisis, have really worked and developed our ability to communicate on a regular basis, transparently, and providing every opportunity to let everyone know what is happening, what we are doing, what we need them to do. And finally, I would go to the issues around trust. And that trust has been incredibly paramount, because what we've done is ask individuals to do incredibly difficult things. And in order for that to happen, you have to have trust. And you get trust by actually what I talked about in the first 3 opportunities, from the standpoint of communication, simplifying, and making decisions. I don't really know what's going to happen moving forward after the pandemic, especially with those that have been on the front line. How has our trust affected them? So I'll just tell you a story. At the end of World War II, Dwight Eisenhower had to make some significant, important, very difficult decisions. D-Day, what to do there, the Battle of the Bulge, as 2 examples. In that, he exposed an incredibly large number of American soldiers to harm's way. And he knew that. He knew that many of them were going to die. Prior to sending them out, he visited with them, and he told them what they were doing. He told and thanked them. So he developed a trust with the American soldier. About 1951, after the war, he was asked to speak at a veterans gathering. He was extremely nervous, very anxious about the talk, because he felt that he was going to be booed, because he had put these individuals in harm's way. And he felt that he was going to be totally put out from that standpoint. So he arrived at the meeting for his presentation, walks in the room, and receives a standing ovation. and thank yous from his troops, from the troops, because they trusted. And I think that we should think about that and appreciate that as we move forward. Trust is incredibly important. I'll stop there and turn it back to Peter.